So we're here with Dr. Peter Khan, and we're so grateful to have him on board with us. He's a functional medicine doctor who is certified in chiropractic and chiropractic neurology, and he's also achieved fellowship status with the American Institute of Integrative Medicine. So he's got a lot of amazing certified experience and a lot of clinical experience dealing with over 5,000 patients, and also seeing all the issues with autoimmunity in food. He has a certification as a gluten certified practitioner as well, among other things. So the way we do this is we're going to read out questions. Dr. Khan and I will go question by question, read them out, and then we're going to answer this group of people. The questions have been grouped into subsections so that we can focus on the solution. If we're just chasing symptoms and problems, then people will never get better. They just find themselves sick and continuing to chase issues.
And these are great questions, by the way. You know, the very first question by Barbara, you know, how do I overcome autoimmune diseases such as RA, chronic fatigue fibromyalgia? Well, you know, autoimmune disease is the umbrella under which all autoimmune diseases are categorized, right? So let's use cancer, for example. Under the category of cancer, you have breast cancer, prostate cancer, brain cancer, all various different types of cancers. But they're all just cancer happening in different places. You have to think of autoimmune disease, all different types, as really the same disease, but different flavors of the same thing. Depends on what body parts it's attacking, we give it a different name, but rose by any other name is still a rose. So autoimmune disease, doesn't matter what type, it's all autoimmune. So the overarching principle is that you want to heal the immune system. You want to put the immune system in remission so it's no longer attacking your body. Okay, now how do you do that? There's usually some type of trigger. So your immune system's job is to protect you, not to attack your own body. So there has to be some type of trigger that's either triggering a flare-up for you, or that has triggered in the beginning, but things are continuing to, the trigger is still there for some people. So these main triggers you want to look at is dietary triggers. So that's food, there may be certain food that you're sensitive to that you may need to eliminate. But then you also have to look beyond food. Sometimes not just the food, right? Especially in my, private online one-on-one consultation practice where people, come to me, already have tried everything and done everything else. Many times they come to me already on paleo or AIP or vegetarian diet, but they're still not feeling well because it may be more than a diet. Maybe you have an infection, parasites, candida, underlying viral infections, that may need to be addressed. Maybe it's more than just food in the sense that you have some type of environmental toxicity, heavy metals, environmental toxins, or whatnot. It may be other issues like, you may have some type of a cortisol issue, stress hormone. So whatever the triggers are, you have to identify them and eliminate them. You can support the immune system in many ways, and one of the ways is through improving detoxification. Another way that you can improve the immune system is by supporting your gut health, because 70% of your immune system is in your gut. So by doing some type of gut renewing protocol or a great detoxification protocol, you can go a great length to improving your immune system. When it comes to cancer, you have to think of cancer as an immune system problem. Okay? We all have circulating tumor cells. So when oncologists tell people that, oh, you're cancer-free, that's not true. That's not true in the way that they're expressing that. It just means that they don't have any cancer tumors of a certain size that they can detect. But we all have circulating tumor cells. The only reason that I don't have cancer that I know of is because my immune system is healthy enough to where it's killing off the cancer cells before it sets up to a certain size so that I don't have cancer, right? So really you have to see cancer as an immune system problem. So when it comes to that, then how do we improve the immune system? As I said earlier, one of the best things you can do is decrease toxic load. So your immune system is there to protect you. So pathogens, chemicals, metals, it's there to identify these pathogens and help your body eliminate it. So your immune system, if it's encountering a high toxic load, whether it be infections or metals, it's going to put a strain on your immune system to constantly have to fight something. And it's going to decrease its ability to fight other things. So one of the best things you can do to support the immune system, which a lot of people think is counterintuitive, is, I need to take an immune boosting supplement or herb. Not necessarily. Now, keep in mind that from a natural perspective, we cannot say we're treating cancer, right? But we can certainly support the body. So for example, my father had liver cancer at the age of 75. And at that time, I was still in chiropractic college. And with the little bit of research, a little bit of things that I know, we made dietary changes, gave him some very basic supplement to support liver health. He was able to live 5 years symptom-free. That extended his life, and he had great quality of life.
We are living fast-paced lives. We're always being on the go and trying to keep up with this hectic pace. Constant stress increases our cortisol levels, and along with other factors, poor dietary choices and lack of exercise and restorative sleep create an inflammatory response in our bodies. It's the perfect environment to trigger autoimmune disease. By living a life that taxes our body but doesn't replenish it with nutritious foods, our body struggles to heal itself from inflammation. This is why protecting our bodies with great nutrition, adequate sleep, and exercise is so important. Okay, I am so glad to be here right now with Dr. Kathleen Geringer. She's become a dear friend, and the approach that she has to medicine in regard to understanding what are the true root causes of what's going on inside the body and how to correct the underlying issues, how to create and use regenerative medicine, how to use supplements, tools, protocols, diet, to help heal the body. I mean, I'm seeing her, she's got fantastic results with her patients. I've consulted with her myself because of the fact that, and my family, because I really appreciate the wisdom that she brings to this field and to this conversation. And so it's such an honor to have you here and to be able to work with you and to have you share this amazing information that we're about to share that really could change somebody's life. So thank you.
Well, absolutely. Jonathan, thank you so much for inviting me here. And of course, we're talking about a topic that I absolutely love, autoimmune. And so we can start right out by talking about what we need to do to really fix our body, repair our body, and rebuild our body back on track again.
Awesome. Dr. Geringer, you really certainly have a passion. You see the suffering. I mean, the cases are so extensive. The person that's watching here from home is likely going through something quite serious. They have loved ones that are suffering, and they're looking for answers. And it's such a struggle. I mean, what have you seen when it comes to people in their journey, their pursuit, searching for answers, feeling bewildered, trying things and having things not even work for them? Perhaps you might even know why that may not be working for them. What's been your experience?
Well, it's really sad, Jonathan. I've been practicing for about 20 years now, and our demographics are changing. We're seeing a younger generation having these issues, these autoimmune issues, and they've been to so many different doctors, and they're like, what's wrong with me? And the doctors will run all sorts of tests and say, oh, you're okay. You are fine. And they're like, okay, I'm okay. And they get back home and they eat something, and then their stomach acts up, or suddenly the hair falls out, or they can't sleep, or they're having anxiety issues. Those are symptoms. Your body's trying to tell you something. And I always tell my patients, your body is trying to tell you something, and you are in control of it. So your job is to talk to your provider, explain to them what you're feeling and how you're feeling. And going back to our gut issues and autoimmune, the labs might seem normal. However, that is at what we call a cellular level. It hasn't hit the glands yet. That's why when you look at a range, a lab range, it's high or low. For a functional medicine, we look at the root cause. We look at optimum range. So when we talk about optimum range, clinically, we call it you're having subclinical signs and symptoms. It has not become a full-blown granular yet. It's attacking you at your cellular level. So what in heavens does that mean? Going back to our topic here, autoimmune. So autoimmune, actually, what it does is that it attacks multiple systems, multiple organs. So we talk about cellular versus granular. 80% of your immune system is in your gut. So it's so hard for us and so important for us to balance that gut microbiome. When we talk about the gut microbiome, we're talking about intestinal permeability. What does that mean? A term that we use, we know it's called leaky gut. What is leaky gut, Dr. Garinger? Well, it's really simple. It's your body is going through this inflammatory process where the cells are confused. They don't know what to do. So what we want to do is that we're like, okay, how did it happen? Why me? Why am I feeling fatigue? Why am I having anxiety? Why am I having sleep issues? And we hear that over and over again, and they're like, well, my doctor said my labs are normal. And we kept hearing that.
Got it. And then you weren't okay with just that simple answer. There was clearly some issues that you could see, and you were willing to push further. And so what was the discovery when you pushed further? What was really under the hood? What was, did you discover something that was in any ways what you weren't expecting when you deep examined that at a deeper level?
Yes. Well, what we find out is that at a cellular level, we order some labs. We establish what we call a baseline to see where do we start, because these patients, they're coming in, they're having multiple signs and symptoms. So we step back and say, let's look at your body as a whole entire unit. Let's see what's going on in your gut. So let's talk about what we call gut permeability, AKA leaky gut. So we start out with this cell. Your cell is this beautiful intestinal mucosa that just wraps around it. And then you have something called villas. They're like these little finger-like pouch that comes up. So when we go through our life as a child, as a teenager, as an adult, sometimes if we eat the right stuff, the villas are able to absorb the nutrients that you're putting inside your body. It's almost like when you think about a net. Some people say think about a cheesecloth where it's really tight and you try to pour water in and it just seeps through. So that's how your gut intestinal mucosa membrane should. However, when we start putting our body with bad stuff, it can be food, or it can be your genetics, or it can be a physical trauma like an accident, emotional, environmental, such as glyphosate or fluoride, chloride, and bromide. And we'll go back and we talk a little bit about that in a little bit. So these tight junctions kind of loosen up like this. So it becomes like a gap between there. All these proteins starts to leach right through, and that's what we call leaky gut.
Now, leaky gut is a bigger deal than what a lot of people think.
Yes.
So one, how widespread is it? Two, what are some of the symptoms and issues and diseases that develop from leaky gut?
When we talk about the leaky gut and these tight junctions, so these little proteins or these pathogens or even food allergens, they leak right through these membranes and they go right through your capillary, your vessels where your red blood cells are. So these pathogens can manifest itself to different areas of the body. We also talk about the gut and the brain connection, and that's like fascinating. When you eat your food needs to be broken down. That food needs to be broken down into nutrients. That nutrients gets absorbed through your small intestine. The small intestinal tract is 23 feet long. It's almost like as long as your tennis court. What happens there? The food gets broken down and it gets delivered. It provides the nutrients to your organs, to your lungs, to your heart, to your kidneys, to your adrenals, to all these organs that your body need, even your brain. So when we talk about leaky gut, what happens is that these protein seeps through these mucosa membrane so they can block cellular action. So at a cellular level, you might have these signs and symptoms that has not been fully diagnosed as a lupus or MS or Alzheimer's or autism or even Hashimoto's disease. We have numerous autoimmune cases where, again, the patients are having these signs and symptoms, but they're a little bit lost in our standard of care, because with our standard of care, there's no treatment for it. They don't know what to do until it becomes full-blown. When it becomes full-blown, what happens to that particular patient is that the lesion is already there. Then what is the treatment? The treatment is really almost the same. It's a cookie cutter treatment. Number one, let's put you on some steroids. Number two, let's give you some antibiotics if you're having any kind of like infection going on. Or number three, painkillers. So those are the three options that the medical profession usually offer.
Before we continue with this episode, I want to take just a moment to share with you about a special program that we have for people that are looking for extra help. Now, what we've found is that people struggle because they feel alone in the journey and they're finding themselves guessing and experimenting so much, and they get discouraged in the process. And that's one of the most disappointing things for me. As I've shared this information, a lot of people have taken the information and they have felt alone in the process. And when they've come up to something like a challenge, they've often felt like, maybe it's time to give up. And then that halts their healing journey. And I've felt so discouraged seeing that in people. And I've wanted to solve that problem. And that's what we solved. You're gonna see some stories here in this episode about people that have had transformation, like Natalia, and you'll see this through the series, and you'll see these amazing breakthrough case studies of people that have got tremendous results. And one of the most profound things that you'll find here is that they actually not only use the information, but they use the special program that we created to get these results. And this is what we're offering. And not only are we offering it, making it available to you, but we're also giving that as at a fraction of the price that we normally offer it for, along with a lot of bonuses that we don't give at other times. And some of these things include going through a full 4-month program of supplements specifically designed. We've had experts, doctors from this series helped to come up with this program and the formulations to help remove these toxic infections and help restore the gut and remove parasites and toxic heavy metals. And this is the program that Natalia used. It's with Well of Life. And we've found people get tremendous results when they use this. And so we've made it available to you, as well as the weekly sessions that we have with the doctors from this series, like Dr. Brooke Goldner and Dr. Khan and Dr. Geringer. And they're going to be sharing with you how to stick with this protocol, how to get transformations, answering your questions. And it's really a very enjoyable, fun process. And you look to your left and you look to your right and you see other people getting results, and it helps you to continue when you feel stuck or you're not sure what to do next. You're getting the direct advice and you're seeing other people in this coaching session to also going through the same experiences, and you watch them learn and grow and you find yourself doing the same thing. So we've made this available to you. We're meeting also weekly with a nutritionist to make sure that we're on the right path with the diet and sticking with this and overcoming hurdles and challenges. And we're making sure that this is tailored to you, and that's why you get to voice what's going on for you, so the doctors and the nutritionists can answer you directly, as well as having some support directly one-on-one with a health coach during the time that you're in the program. So you can learn more about this by clicking below. And again, we only have this available for a very limited time, just during the screening of this series. And so then we close it down after that, and we're focusing on serving the people that have said yes, so we can get them the best results possible. And to make that possible for you, we've made it available with payment plans and other ways. To make sure this is something that you can do, we've made some options available so it's affordable for you. So you can simply click the link below to check it out so you can learn more and take advantage while we're offering this very special discount during this time with all these bonuses of direct support from our community, our experts, and with this special program designed to help you heal along with the weekly modules that we have teaching you how to go about healing the root cause of autoimmune disease, inflammation, or whatever other issue you might be struggling with, or simply how you're trying to prevent or achieve the most abundant health that you can. Again, just click below to learn more about that. And we're going to continue with the rest of the episode now. I hope you enjoy what we've got to share today. What exactly is considered good nutrition? Because we've spent our lives surrounded by junk foods, fast foods, processed foods, sugary snacks, and aisles of prepackaged so-called healthy foods in our supermarkets, we often don't question the nutritional quality of our diet. In fact, the standard American diet is drowning in sugar, salt, saturated fat, trans fat, refined carbohydrates, gluten, hormones from factory farming, GMOs, preservatives, and artificial flavors and colors. It's high in calories, but low in essential nutrients. It compromises our gut health and makes our bodies susceptible to toxicity and parasite infections. As a result, our bodies are battling pain and inflammation while being starved of the essential nutrients that could help heal it. But we only make things worse by turning to prescription and over-the-counter drugs for short-term relief and end up with long-term side effects. Permanent relief comes from healing the root cause of these symptoms. Detoxing removes harmful toxins, molds, parasites, pesticides, and pharmaceuticals from our bodies. And eating healthy, nutritional meals, exercising regularly, and getting restorative sleep heals our gut biome and reverses our inflammation levels. Thank you for being here. Let's talk about what you think is really a big deal right now when it comes to gut health. What's the issue that people are facing?
So my godmother is Liz Lipsky. Do you know who that is?
Ah, that's right.
She's one of the OGs of functional medicine and one of the first people that started talking about leaky gut decades ago. She wrote the book Digestive Wellness. So actually when I was 17, I moved in with her and watched her do a ton of nutritional interventions. And the first thing that she always did was gut health. Gut health is the foundation of everything. She's amazing. So she's one of the OGs of functional medicine.
Yeah. So she coined leaky gut.
Well, I don't know if she coined it, but she was certainly one of the first people to start talking about it 20 some years ago, which is pretty outstanding. It was very forward thinking.
Yeah.
And really, when you think about the GI system, that's where all your nutrient absorption happens. It's not what you ingest, right? It's not what you take in. It's actually what you absorb. That matters.
Yeah.
Gut health is a foundation. I mean, it's a foundation of my practice for sure. So one of the things about gut health that I think is often overlooked is what you need to feed the GI tract. And in terms of feeding the GI tract, there's enterocytes, and glutamine is really important for that. And that is an abundant amino acid that's found in your body, but also nutritionally through dietary protein. So glutamine you can ingest through nutrition, and that would be through high quality protein, which, you know, I tend to like animal-based products, but if you're more plant-based, you can actually even just take glutamine from 5 to 10 grams a day, and that really helps. It helps heal your gut.
Awesome. And so then gluten, bad, glutamine, good.
Yeah, hey, that's clever. Yes. Yeah, I tend not to recommend gluten in the US.
Yeah.
It's different in other countries. I think people can eat gluten, and the way in which the wheat is processed is a bit different. But certainly here in the US, I've seen nothing but inflammatory issues with it.
Yeah.
It happened to me. So when I was pregnant, I started eating gluten. Yes, I did, because I was so sick. And all my inflammatory markers went up. And then I stopped, and I got better while I was pregnant.
Yeah.
Yeah, so gluten is really bad news for people.
Yeah.
And we were talking about earlier, processed foods. If you really want to have optimal health, and even as it relates to gut health, you really want to have whole foods. And I think balancing everything appropriately, meaning your carbohydrates, proteins, and fats, are essential. When people are eating a ton of volume, so let's say raw vegetables, definitely can affect digestion. There's a balance that has to happen. So healing the leaky gut is actually different than I think what a layperson would be doing. It's not a juice fast. It's not a whole bunch of juices and raw vegetables. It's probably the opposite. When I look at really working on gut health, number one, you have to find the pathogen. What's wrong? Is it SIBO? Is it a parasite? What the issue is? And then once you determine that, then treating it. The step after that is healing it. Number one is getting your nutrition right. Definitely when it comes to gut health, it's balancing carbohydrates, proteins. And on another aspect of that, so, we were talking before the camera started rolling about gluten, excess refined carbohydrates, and things of that nature. But what about pathogens? That's something that I see a lot of, especially with my patient population. And that could be whipworm, schistosomiasis, Entamoeba histolytica. I take care of a lot of individuals who travel quite extensively. And this is something that I'm seeing it, we don't have great tests for. So we're talking about parasitic infections. We don't have a great way to test for it. We use PCR testing. And what I found is that the tests that we can do in the clinic are not that great. And you know what that means? Unfortunately, people need to go to an old school parasitologist with a rectal swab. It's true. It doesn't hurt. But it makes for an awkward first visit.
Cool.
Yeah.
And so then people do that and they can discover what's going on.
Yeah, so I see it a lot. And when you're looking at blood work, sometimes they have elevated eosinophil count, an elevated eosinophil count. More often than not, though, you don't see much. You see symptoms, abdominal bloating that they've tested for SIBO and they don't get better, candida that they've treated, but they're still not feeling great. And then you get their travel history, or they tend to eat a lot of sushi. And when that happens, more often than not, they have a friendly ride-along parasite.
Dr. Perlmutter, I'd like to go for a moment with you inside of some of the therapies that people can use to get some helpful, pleasing, effective results when it comes to repairing their gut health. Supposing that somebody has leaky gut, supposing that that leaky gut may be causing other issues, anything from autoimmune issues, which is the very common correlation, correct, right?
Sure, absolutely.
Leaky gut, intestinal permeability, autoimmune issues hand in hand because of the fact that we're having our food pass through the intestinal walls into the bloodstream. And this causing a necessary attack, which people don't talk about a lot, a necessary attack, because we have now the body's ability to deal with a toxic invasion that's happening just because of a gut that's permeable. And then all the on-flow effects, but just getting inside of this issue of how do we turn this around. We talked about the gluten, so this is certainly something, the wheat, getting off the foods that are causing the leaky gut would be clearly by default an amazing step to take, but so you could obviously go there, but I'm really curious for the things that people can take that help to heal that intestinal permeability to then heal the other related issues.
So as it relates to the gut and fixing things, we have to look at two areas of interest: remove and replace. We want to remove those things that are damaging the gut, and we'll talk about those, and then replace what we've removed with things that can help rebuild a healthy gut. But I think it's really very instructive to, again, focus on the fact that food is the biggest player here in terms of the health or lack of health of the gut bacteria. When we've eaten inappropriately, we threaten the diversity and the functionality of the gut bacteria, whose job it is, one of their jobs is to maintain the gut lining. So we eat bad food, the gut bacteria can't maintain the gut lining, we get a permeable gut, that increases inflammation. And what does inflammation do in the brain? It leads us to be unable to make good choices. So what do? We eat the wrong foods, and we're back where we started, and it gets worse and worse with time. So inflammation is threatening to good decision making as it relates to the food we eat, as it relates to turning off our televisions at night, getting a good night's rest, as it relates to making sure that we exercise regularly, making sure that we connect with other people, meditation and exposure to nature, all powerful ways of reducing inflammation in the body, and really are manifestations of making good choices. So that's really important. The foods we eat ultimately influence our ability to make good decisions. A very important concept. So foods that are not good for the gut, that we know, highly processed, high in sugar, high in refined carbohydrates, foods that really lack good levels of fiber, and certainly beyond foods, so many other things threaten the gut bacteria, like antibiotics. That's probably on the top of the list. Antibiotics, these are chemicals designed to kill bacteria. Well, big surprise, they're threatening the bacteria in the gut. They're not happy about that at all. So I think it's really very important that we explore that. What's happening? We're basically setting the seeds for a different type of microbiome. And what we now know is that that's a microbiome that's not necessarily healthy.
Got it. Thank you. And so coming into the question around specific tools that people can use to heal leaky gut, or as it were, or how we could understand that, there appears to me from the research and from a lot of anecdotal reports that are coming out that there's often layers of toxicity or infection that prevent the leaky gut from being healed. So some of what I've been seeing working, I'm curious on what you're discovering and what you think in regards to certain tools, certain medicinal plants or foods that can come in to help remove the buildup of toxins or the impacted fecal matter or the possible parasitic infection or possible heavy metal exposure. And are there tools that can help sponge or take these toxins or remove these things from our body, help our body naturally eliminate them? And if so, what would they be? And does that work to heal the intestinal permeability?
So job one, as it relates to reestablishing gut health, is to first get rid of those things that are threatening, and then introduce the right food. Food is on the top of the list. There are a lot of other ideas about frequent enemas, about using high levels of things like magnesium sulfate or magnesium citrate, various types of nutritional supplements that help to purge the bowel, the addition of various types of fibers, use of chlorella, for example, for helping persons detox from heavy metals. But I think the biggest, the heavy lifting is done when a person recalibrates his or her diet. Who knew? It's on the plate. And what you really want to foster is an environment where these gut bacteria are going to be happy, where they're going to repopulate, they're going to reproduce and make more of themselves, which is what we want for the good bacteria. And it really means nurturing them. And how do we nurture them? With dietary fiber. So fiber-rich foods are really critical here. It is I consider it a macronutrient. We say the macronutrients are carbs, protein, and fat, but I think dietary fiber, which by definition I know is a carbohydrate, so that's probably why you don't talk about it, but I think it should be emphasized perhaps as a macronutrient here in America, because we get 10 to 15 grams of dietary fiber a day. And what does that mean? In the face of the fact that more primitive cultures that have been identified living today will take in as much as 100 to 110 grams of fiber a day. And we suspect that our ancestors did the same thing, our hunter-gatherer forebears. So having a lot of good dietary fiber is really front row in terms of nurturing your gut bacteria to do what they want to do and to repopulate. So they repopulate, they replicate, you can measure that in laboratory studies, and they begin to manufacture metabolic products that are good for us, the B vitamins, the neurotransmitters, the short-chain fatty acids, a variety of things that we know are good for us beyond the gut. So we build a better companion by having a better microbiome, as if it were a thing. People develop the problems that are a consequence of a leaky gut. What do they develop? Arthritis, autoimmune conditions, coronary artery disease, cancer, diabetes, Alzheimer's, which may relate to leakiness of the gut. And modern medicine focuses on the symptoms of those problems and generally neglects what's causing them in the first place. Again, focusing on the smoke, but not the fire. We've got to ask ourselves, why are these problems happening? And I recently gave a talk to a bunch of mainstream doctors, and we were talking about how do you treat diabetes? And all the hands went up. I use this drug, I use that drug. And I said, you know, those drugs don't treat diabetes. And, you know, everyone said, well, what do you know? I mean, I'm a neurologist, what do I know? And I said, well, you think about it, how do you know if the drug is working or not? They said, well, the blood sugar goes right down. So we know the drug is working to treat diabetes. And I said, but listen, the primary problem in diabetes is not elevation of blood sugar, it's a problem with insulin sensitivity. That's where this begins. That's why as we become more and more into getting diabetes, our insulin levels are getting higher and higher. And even though the insulin levels, which hopefully will lower our insulin, the insulin's getting higher and higher, it doesn't work anymore because we become insulin resistant. So back to the group of doctors. You use these drugs to treat diabetes. Well, what happens 2 or 3 days later if people stop their drugs? Well, their blood sugars go back up. So I said, so obviously you haven't treated the problem. It's still there. The whole time you're just simply treating a symptom, a manifestation. Again, you're not focusing on the underlying problem here, which has to do a couple steps earlier with this insulin problem.
So for me, the things that really moved me about your story are the ones that I want to go back into, because I feel like these are important parts for the people to understand. Why don't you give me like basically the what happened to you, how you ended up in this position where if you didn't get the chemo and radiation, you'd have to have your legs amputated, your kidneys were failing, and then you're in this desperate situation. You found Health Secret, you found Well of Life, and tell me about your story, Natalia. I really am excited to hear it.
Okay, so actually my journey started about 5.5 years ago. Before, I consider myself like relatively healthy. Maybe not 100% issues there, here, a little bit blood pressure, something like this, but not much. And then it's happened, I had some problem in family with my mom, and I was under terrible stress for about 2 years. I guess it's when it started, but at this time I just didn't realize yet, because my body's still working. Then we went to Peru for vacation, and it was 1 week vacation, and there I got infection. I got stomach infection from raw fish, from ceviche, what it's really tasty, but I guess like other people also got it, but not all got sick like I did, because maybe already my immune system was very weak to this point because of stress, 2 years stress. And after that, when I came back, I started to feel a little bit better, but for short time. After that, it started UTI. I took antibiotics for 2 weeks, then another UTI, and the whole summer. So I was there in May, and whole summer I was kind of not very sick and not very healthy. It's like one problem is another problem, and then by end of August, I remember like it was yesterday, I just prepare everything in the evening for my work next day, lunch and everything and clothes, and then in the morning I couldn't even not even stand. I couldn't even turn my head. It was so terrible pain in muscles. It's difficult to explain. So, but you can't even sit. You can't do anything. And of course I went to doctor, and they didn't know what is this, and it was very strange. So I understood that it's something wrong, really wrong. And I went to doctor, they didn't know what is this. They ran different tests, and they gave me steroids. and big amount of steroids by special schema. And in 1 week of steroids, pain gone. I didn't feel very well, but pain disappeared. But when I stopped it, it was much worse. But now joints were involved as well. So I practically I was not able to work. So I just, it was very difficult because I went from one doctor to another doctor. Finally, I had an appointment with rheumatologist, and they told me, they did a lot of tests, bunch of different tests, and they told me that you have rheumatoid arthritis. But marker was okay, it was normal. But still, they told me by symptoms it's rheumatoid arthritis because all joints were involved. And X-ray already shows this, that it's already damage in this, damage in spine, damage in actually each joint. And it was pretty bad. It's like inflammation. My spine was so inflamed. This is why I had muscle pain, because it was inflammation in spine. And they told me, you only have one choice: big amount of steroids, big amount of chemo, that's it. And I asked how long. They told me until end of your life. They gave me brochure. When I read this brochure, I was absolutely terrified. There was 15% of kidney cancer or failure of kidney, and they just cheerfully told me, don't worry, we will do dialysis if you failed. It absolutely was not good answer for me. I decided to find something alternative before I do this chemo and steroids. And I decided to try what usually in my life helped me with different other issues. It's water fasting. But at this moment I was afraid to do that by myself, because I usually do it by myself. But here, because my blood test was so bad, inflammation level was so high, that I decided, I found a clinic in California and went there. I was there 2 months for water fasting and for juicing. And from their point of view, it was kind of success, because my inflammation level went down for 25%. But it was so high that it's even 25%, it's still, they told me that they never ever had so high inflammation in any person. And so I just came back and decided I need to find some functional doctors who will help me. But my condition was worse and worse and worse. I changed my rheumatologist because I just didn't like attitude of first doctor who told me, oh, don't worry, we will do dialysis. Or he told me, it doesn't matter what you eat, you can eat everything, it doesn't matter. So I changed a doctor, so I went to another one, and she told me that you are in really bad condition. It's so bad condition, and at this moment they also found that by just chance there was practically no pulse in my legs. They couldn't hear it. They sent me to test, and the first ultrasound, then they did CT scan. And they found that my vessels, they thought that it just maybe some clog, they just will do surgery and put stent there, and it will be fine. But then they realized that its whole arteries became almost collapsed, like whole. It's not at one part, just completely whole arteries and legs. And after that, they told me, okay, now we know it's vasculitis. It's inflammation of arteries, inflammation of a vascular system. If you would not take right now chemo and steroids, we give you maximum 2 weeks. More than 2 weeks, you will not survive. We will need, if we will be on time, we will we should amputate your legs, because practically almost no blood goes to your legs. So
under what circumstances would they amputate your legs?
if I would not take this steroids and chemo, because I still was, afraid to take this medicine, because it was so terrible side effect.
And describe what your legs looked like.
Oh my God! It was my legs were the first. They were swollen, very painful. Muscle were painful, and joints were painful, and they became so big. It's like elephant legs,
Elephant
huge
legs?
Yes, I had it's like big. I measure every morning. They were a little bit less, and I measure each evening. It was few inches more. So it was. And they told me, that's it. So you need to make decision, otherwise it will be too late. And I asked them how many days do I have, and they told me 2 weeks, it's maximum. And I went to another doctor, to Michigan, alternative doctor, functional doctor. There was different procedures, intravenous vitamin C, ozone camera, different kind of, but nothing helped. So finally I gave up and started to take this medicine. And almost immediately I started to have side effects, and eventually I was able to walk. It's still with pain, but I was able to walk. I couldn't work, but I was able to walk at least. And but it was absolutely terrible. It's not like it was before, so it was no life practically. It was, but then it started side effect, and side effects was so terrible. I even now don't know what is worse actually, illness itself or side effect. And because I had pain all the time, I couldn't sleep, I just couldn't sleep during the night because of pain. I couldn't turn. I couldn't do anything. I couldn't do myself go to bathroom. I couldn't do, just to keep a cup of tea. For me, it was big issue. I just couldn't do anything because all my muscles and all my joints were so painful. And actually, I started to have bumps also. Right now, they disappear, but there was like bumps everywhere on my joints, and everywhere this cyst, Baker cyst, everywhere behind my knee, its ankles, everywhere cyst. Because my legs were, you could not see any bones here, it was like this, like water, I would say. So, and, but I didn't know what to do. I just didn't know what to do. I went to different doctors, conventional doctors, and doctors functional. And all of them, they try to help, but actually it just maybe helped a little bit, but not much. And I understood that something wrong with that. And by the way, 2 doctors, they honestly told me, sorry, you have so difficult case, we don't know how to help you. You have even worse scenario because you have combination of different autoimmune. I kind of started to gain one by one. The first it was rheumatoid arthritis, then vasculitis, then Hashimoto. So it's kind of non-stop. And so I just don't know. It was time because I had so many promises from doctors, from conventional the first, then from functional, and you can't imagine how many doctors I saw. I even don't remember because I know for sure it's more than 20. It's for sure, maybe more than 30. But result was the same. So I still was on chemo and steroids, but now I got already problems with kidney. I started to have problem with stomach. I had precancerous spots in stomach. My right kidney shrank twice, and so on. So it's like additional problems to my previous problems. And so functional doctors in the beginning, each of them, they told, okay, we will fix it. Don't worry, we will fix it. Everything will be fine. And I always hoped, okay, maybe 1 month more of treatment, very expensive treatment, and it will be better. But it didn't happen.
A holistic approach to healing the body. There's usually more than one root cause of autoimmune disease. So healing the body requires a holistic approach rather than an isolated one. There are many autoimmune diseases which lead to body and joint pain. By correcting our diets, we help reverse inflammation. We can further reduce pain through chiropractic practices. By doing so, we actually target the root cause by correcting structural issues. This is why it's important to consider the physical changes we can make to correct the root causes of our symptoms rather than resorting to the temporary fix that Big Pharma may provide.
Dr. Furman, it's a privilege to be with you today. You're a medical doctor. You have a lot of experience in conventional medicine and in what people would consider alternative or integrative. And so I would really just be very blessed to find out what your perspective on this whole matter is at large, what you perceive is going on here. And then especially as we continue through the interview, to go into all the things that we can do to protect ourselves and our families and boost our health overall. So yeah, please share, Dr. Furman. Thank you for being here.
Thank you, Jonathan. Really appreciate that and appreciate this opportunity to talk about this issue. And as you know, I'm a board-certified family physician, and I don't consider what I do, by the way, alternative medicine or integrative or complementary medicine. I consider what I do to be correct healthcare delivery, correct medicine, right-directed, and progressive. It's where all doctors should be and should have been over the last few decades, because right now we have a population dying of diseases of nutritional ignorance. And the common cause now, about 70% of people over the age of 65 die of heart attacks and strokes, which are almost totally avoidable with excellent nutrition. That's the reason I became a physician, because I've been a specialist in nutritional medicine for the last 30 years. And I've spent my life treating people with severe autoimmune illnesses and other severe chronic diseases and nursing them back to excellent health. My mantra has always been, don't take drugs the rest of your life. Don't accept being sick. Get well, you can make a complete recovery. And even in my book, my recent book, Eat for Life, has maybe a dozen or more cases like that. People who recovered from severe lupus, rheumatoid arthritis, ulcerative colitis, multiple sclerosis, even autoimmune hepatitis, Sjogren's, all types of serious autoimmune conditions. And some of these people, I care for these people, and it's my most rewarding experience of my career. Is I take people. I have a person right now at my retreat right now in San Diego, where she's been on like 15 different medications, suffering terribly, and we're trying to nurse her back to health and wean her slowly down off those medications. And this has been my major focus of my career over the last 30 years, is telling people they don't have to remain sick for the rest of their life. And nutritional excellence can enable wellness. And it's a combination of factors. It's to be most effective and get predictable results, not having a case that happens once in a while, but having predictable results so people who have psoriasis know that we can clear psoriasis nutritionally. With people with lupus, that you don't have to go into kidney failure and be on Plaquenil, methotrexate, and prednisone the rest of your life. You can get well and be free of lupus. Whether you have chronic headaches, what I'm saying right now is the same excellent nutrition that enables us to age slower and prevent cancer, when applied to people with serious illnesses, can work therapeutically to induce reversal of disease. And it's not just the nutrition, the dietary and the food choices. It's also the use of sprouts and microgreens and vegetable juicing and the right type of supplements, of course, including things like turmeric, astragalus, mixed mushroom extract, green tea extract, some curcumin compounds. In other words, elderberry. We're giving, when we supply the body with the right type of biochemical system, we can start to normalize function better, and we can see tremendous reduction in inflammation and pain. The body is literally starving, and it's starving of nutrients, and it's poisoned. And the combination of starving with nutrients it needs and being poisoned at the same time. And what I'm saying to you right now is two things. That when you don't eat right, you build up metabolic waste products, you build up poisons created by the body itself. So autoimmune disease is an excessive immune response where the body reacts and attacks its own tissues. And now the own tissues are not normal tissue. So we have two things going wrong. We have abnormal tissue that the body's reacting to. In lupus, you attack the kidney. In psoriasis, you're attacking the skin. So we're attacking different parts. In inflammatory bowel disease, you're attacking the lining of the bowel. But we have antigens in the immune system attacking our own body because it's recognizing the body as abnormal, because the body is not normal. It's overly burdened with toxic waste products, and its cell structure and function is not functioning normally. And then you have the response of the immune system against the abnormal cells is an abnormal response. It becomes a hyperactive response that can't be turned off because we don't have activation. We're not activating our T suppressor cells adequately, and our ability, the immune system is not controlled. It overreacts now. It's turned on and it overreacts and it destroys the body. So when we're doing this holistic approach, so to speak, removes the toxins from the tissue, exciting the immune response, and it gives the body the nutrients it needs to normalize the immune response so the reaction it has against the tissues can be more controlled. And I'm saying that using these techniques, we have predictable positive response in the vast majority of people and able to recover from autoimmune diseases, which can otherwise be life-threatening or threaten your health and your well-being throughout your whole life. And then the conventional approach to those diseases require people to take powerful chemotherapeutic agents that suppress your immune system to reacting against the antigen-stimulating toxins. And you've made the body more toxic in order to make the person have less arthritis pain or to make the skin look better with lupus. So they have specialists called rheumatologists that give people these chemotherapeutic agents so the rheumatologist can monitor these people and check their blood over time, because we know these drugs cause cancer and shorten people's lifespan. So you're making a pact with the devil. I'm not saying the rheumatologist is the devil. I'm saying the drugs are the devil. You make a pact with these drugs to feel a little better temporarily, and you accelerate your death in the process. So to feel better, you have to accelerate your death. And they don't work that well anyway. And people have a lot of side effects and don't feel well. So you're giving people hope, and I'm giving people hope, and that there's a better way. There's a new, and this is a lot what I do at my facility in San Diego, where people come and stay with me for a few months, specifically to get well from these chronic illnesses that their doctors have told them are irreversible. And the greatest satisfaction is watching these people change their health and recover their health again. I've had people say to me, Dr. Furman, I'll eat sawdust if you can get rid of my rheumatoid arthritis. I'll eat, just tell me what to do and I'll do it. They're so compliant because they so much want to get well. They're suffering so much in their lives. And people die of lupus on those drugs. And it's tragic and it's barbaric that they're not being told that they can get well.
Because we get to the root cause of the problem. And we use a holistic model. And that holistic model, really the foundation of it is, number one, a belief that we can heal, right? That our bodies were created to heal themselves. And that if we create the right lifestyle habits, if we create the right environment, then healing is a natural occurrence. So it starts with mindset. Then, as a chiropractor, we get to the structural imbalance. We correct that. We reduce pressure on the nervous system, this term that's called subluxation, when a bone is shifted out of position and puts pressure on nerves and affects and distorts the way that our nervous system is functioning, which can contribute and lead to pain. So we correct that through very specific adjustments and corrective exercises to change the person's posture patterns. And the third thing is we really focus on nutrition, and we use an anti-inflammatory healing diet, which downregulates inflammation in the body and allows the body to adapt to stress more effectively. So we use nutrition. We'll also use advanced supplementation to reduce inflammation in the body and to improve the overall structural components of the body. We also focus on right movement patterns. We've got to change our posture. We've got to move our body correctly. and strengthen weak muscles and stretch and improve the flexibility of tight and restricted muscles. So we focus on that. And then finally, we need to reduce toxicity, right? And so most of us are living very toxic lifestyles. And so we focus on really teaching people how to reduce the toxins in their life, particularly toxins that are contributing to chronic inflammation and maybe detrimental and affecting their pain levels. Yeah, so when we look at autoimmune disease, it's really a three-legged stool. And so the first leg is a genetic susceptibility. And so we know genetics play a role and that susceptibility has to be there. However, twin studies have shown that only 25% really has to do with genetics. The other 75% is what we call epigenetics, or the environment and the environmental stimuli and how that affects our genetic expression. So the other two really, really big stools that actually are larger players than just the genetic susceptibility are a leaky gut, meaning that basically the medical term is intestinal permeability. So within our gut is, I've heard it said as like a cheesecloth, for example, right? And so it's almost like clasping our hands together like this. And so when there's inflammation in the gut and the immune system is activated, it starts to open up these little junctions, and now we get large holes and large pores. And when we're not digesting food particles effectively, we're not breaking down the food particles successfully, like most Americans really aren't, then what happens is these large food particles will get into the bloodstream, as well as bacteria and yeast and different organisms like that, and trigger some sort of inflammatory reaction in our bloodstream that can affect our joints, and our body can go as far as creating specific antibodies to these food molecules, as well as bacteria and viruses and yeast that are in the bloodstream. And now what ends up happening, we end up with a full-blown autoimmune disease. So that's the second major thing. And then the third thing is some sort of environmental trigger. And so what I mean by that is this, is that you can have the genetic susceptibility, you can have the leaky gut, you can have those two there and not have an autoimmune disease. But if you have those two present and then you encounter some sort of a major environmental stress, and that could be a physical stress like a car accident or a significant injury, particularly a head injury. It could be a significant emotional stress like the death of a family member or a relational issue, maybe a divorce or something along those lines. Or it could be a chemical stress, such as being exposed to too many chemical toxins, such as consuming too much sugar, which is really a chemical toxin as well, or environmental pollution. And so if we're exposed to too much of one or all of those stressors at any one specific period of time, it overwhelms our body's ability to adapt, and therefore our body reacts in a sense in kind of a survival mechanism and creates these antibodies to various tissues and creates this sort of autoimmune reaction. The holistic model is a slower model, but it gets to the root cause of the problem. So when we look at back pain or really any sort of bodily pain, particularly joint pain, one of the major causes is a structural imbalance or a structural misalignment. So in the spine, it's very easy for joints to shift and move out of position and start to make changes with how the muscle patterns are adapting, actually literally put pressure and inflammation on nerve roots that can trigger pain. And so if it's a bone that's shifted out of place, kind of like a tire that is shifted out of place on a car, wouldn't it make sense to actually shift it back in place? And if we could do it without a surgery, clearly that's going to be advantageous. And that's really where chiropractic comes in to fix the actual structural imbalance, take pressure off of the muscles, create better symmetry, take pressure off the nerve system and create better symmetry with the muscle patterns. Chiropractic is really foundational when it comes to eliminating back pain and really preventing back pain from even beginning and overall optimizing quality of life. On top of that, in the holistic model, we've got to look at other triggers for inflammation. So we've got to look at diet, lifestyle, the amount of stress that we're under, how we're moving our body, how we're sleeping at night, the major postures that we're taking on when we are at work, so our general ergonomics. We've got to look at all of these different factors and really do an assessment and figure out exactly how to put ourselves in a position where we're not producing rampant amounts of inflammation or causing structural imbalances.
Leaky gut is a term we are now becoming more familiar with. So how does poor nutrition and other factors we previously mentioned cause leaky gut? It starts with the trigger, such as poor diet, which leads to inflammation in the body and, more specifically, the gut. And this causes an autoimmune response, which opens up the protective net of our gut, allowing toxins to leak into our system. Our immune system is triggered by these toxins, so it attacks the body because it believes there's a foreign invader, and this results in autoimmune disease. So there is usually a reason behind the symptoms and autoimmune responses. It is very important for us to look deeper into the root causes if we want to heal the body. It takes a holistic approach to heal the gut and the body.
Dr. Geringer, so let's talk about this relationship with the gut, with root cause triggers. I know you talk about genetics, physical trauma, emotions, environment, and some of the breakdown of specific things in our environment that are creating this. And the importance, obviously, is so that once we understand it, we can remove the triggers. Because if people don't understand this, they'll just be trying to pick up a pill and say, it's not a drug now it's natural, it's just like this supplement or something like this. The pill, it's gonna just do it, I don't have to do anything. And that's a total con. If the triggers are still there, the situation is going to keep creating itself, and anything that you take is only going to be just like gun fodder to this problem. It won't be able to go into the healing process. So why don't you talk about this breakdown and how people can understand these root cause triggers and how that relates specifically to intestinal permeability, also known as leaky gut, and then from that place we can look at solutions.
Absolutely. So again, I just want you to understand that it all starts with an autoimmune response. What does autoimmune response mean? We start with the zymogen, zymoglin, that opens up that tight junction. So these pathogens passes right through these little tight net. It's no longer tight, it loosens it up like that. So these pathogen passes through, causing a lot of food sensitivity or food allergens. So the zymoglin opens up and it creates this leaky gut, and that tight junction is your intestinal lining. That's the lining that lines up your whole intestinal tract, and we're talking about your small intestines where nutrients are being absorbed, and that's 23 feet long. So when this happens, your body's like, oh my gosh, inflammation. Is inflammation good or is it bad? Actually, inflammation is very good for the body. What? But Dr. G, I don't understand. Well, the reason why is your body is that alarm system and say, hey, pay attention to me. However, when we talk about your gut lining, you don't have those pain pathways as if you have a cut or a wound on the outside. Sometimes those irritation, the inflammation, might just be inside that you might not feel it until the symptoms come out. What are the symptoms? It can be breaking out acne on your skin. It can be burping, bloating, gas, acid reflux. Those are signs and symptoms of what we call gut issues. So let's say these little foreign objects, foreign substance, foreign protein that goes right through that junction. Is it a friend or is it a foe? So is it self or is it non-self? If it is a friend, what you want to do is that means whatever you put in your body, nutrients, usually the food that you eat, that means that nutrients will help your body heal. That nutrients is good for your body. That nutrient is being broken down to supply the right kind of nutrients to your heart, to your lungs, to your kidneys, to your adrenals, to your brain. If it is not, it's non-self, it becomes a foe. What happens? Your immune system gets triggered. When the immune system gets triggered, it's like, oh my gosh, what's happening? So it becomes this crazy war that's going on. It's like, oh my gosh, let's attack it because it's foreign. Let's go and help it out. However, what happens is that your immune system gets exhausted. When the immune system gets exhausted, things starts to break down. It's no longer paying attention to your organ system. So when it's a non-self, viruses, parasites, bacteria, foreign protein becomes foreign, so it keeps attacking you. So at a cellular level, you might have all these symptoms, but it has not attacked your glands yet. And that's why when you go to your traditional, conventional doctors, you're like, Doc, I'm having all these symptoms. And they look at your labs, they're like, everything is normal. And that's what we're facing a lot of times, because we have to educate our followers, our audience, you, on how to really detoxify your body, nutrify your body, fortify your body, and the power of the mind.
What do you think it was that allowed you to find the resources that me and my team had created?
Actually, it's my friend. My friend in New York, she had cancer, and she also was looking for, she was very aggressive cancer. And they told her the same, that she would not do chemo and radiation, and she had surgery. But after that, she needs to do chemo and radiation. And they told, if you would not do this, we give you only 3 months to live. And she decided to go to also alternative method, and she decided to try it. And she found on internet this program. Right now she is using this product also after I started, but she pointed me to this program. Right now I point other people to this program, because in my opinion it is the best now. It's just the best, because it's so big difference. It's just no comparison.
So your friend referred the Autoimmune Secrets and the supplement protocol that you got started on, and
okay.
yes,
yeah. I started last summer. It works, actually it's exactly a year ago, no, a little bit more than a year ago.
Yeah.
And in the beginning I didn't feel big difference. I started to feel difference maybe in a couple months, because I was able to decrease a little bit amount of steroids and without flare up. Before, when I tried, it always was flare up. Here I was able to a little bit decrease without new flare up, but still was not like big. I just watch when I watch this series, so I just saw that people tell, oh, in 2 weeks, in 1 month, I just was a different person. I thought, okay, so already 2 months and I still practically the same. 3 months, I don't see very big difference. But I understand that my case was really difficult, so it's maybe more difficult than other cases. So, and when I started to feel much better in 5 months, in 5 months of detox. In 5 months, I started to decrease amount of steroids and even decrease amount of chemo a little bit. And it was very good. It was very good, and I feel no flare up. In 7 months, everything changed. When I started to see these parasites, it was relief immediate. It just was like day and night. You just yesterday was one person and today was another person. It was, you feel just much better, just what, like almost normal. And it was like this, and I was very glad, and I decided I will continue decrease amounts of chemo and see what's happened. And then I got sick. In February, I got terrible flu or maybe corona, I have no idea what I got. but I was in emergency, and they told me if you would take this methotrexate. They asked me if you did this shot, because this was my day for my shot. And I told no, because I was not able. I just physically couldn't see it. And they told me, oh my God, I'm so glad, because if you would do, we would not talk to you. In this condition, to have this medication, you will not survive. So, and doesn't matter what your rheumatologist will tell you, I just tell you, you should not take this medicine before you recover completely. So because I was sick a few weeks, very sick few weeks, after that I just stopped taking, so cold turkey practically. Stopped to take this methotrexate. But I continue these supplements.
So normally the problem would be if you stop taking methotrexate, that you would get the issue with the fluid buildup or the inflammation issues.
Inflammation went up like very, very much. But this time it didn't. It didn't. It just was the same like was before when I was on this chemo. So it's only a result of this detox. And then I started to see biofilms as well. So now I know how it looks like, so this biofilm. So, and this is what, I stopped the supplements when I stopped seeing this in my stool. After that, I just decided to stop. And I feel, now I am free from steroids, free from methotrexate.
What about chemo?
Yeah, no, they name it chemo. It's like just,
Sure.
There's different kind of chemo. So for this particular, they gave me methotrexate.
Is that low dose or high dose or medium?
It was high dose in the beginning, and then I just decrease amount. Then when it was in March, I went to my doctor, to rheumatologist, with new test, blood test, and he, it's improvement, so big improvement. What did you do? I guess you increase dramatically amount of steroids. I don't know, I'm not on steroids anymore. You increase amount of methotrexate. No, I don't take methotrexate now. And he told, it's just impossible. Don't tell me this, it's impossible. I never seen anything like this. What did you do? And I brought a big bag with all these supplements, and I just put everything on his table. And I thought that it's like usual doctors, they just don't even look into this. But he started to look each bottle, because it seems like he was curious why he couldn't explain what's happened. Even I thought that he probably doesn't believe me, that I really don't take steroids and methotrexate. But when he looked each bottle, very, very careful, he spent maybe 30 minutes for this, just looking everything. He even wrote down something. And he told that it's very strange, but it's absolutely nothing harmful in these supplements. It's only herbs, and it's kind of, I don't see how they can help, but no harm. Plus, from my point of view, it's very important that it absolutely doesn't contradict with medicine if I will need to give you something. So this is why, if you like it, continue. But now do test every month, because I for sure you will have new flare-up. It will be much worse than it was before, and we need to catch it in the beginning. So this is what, but it was in it was March, in beginning of March, and since I didn't have anything like except of these supplements.
So you didn't take methotrexate, the chemo, and you didn't take the steroids. You'd only just been taking the supplements, the Well of Life supplements.
Yes. Then after I stopped seeing any kind of worms or biofilms, I stopped taking supplements for a few months. And then again started, because I again started to feel something. I guess it's still, I had something, in my body, it didn't remove completely 100%. Maybe X, maybe, I really don't know. But I started again. And it's, how I understand, it's maybe better to repeat it a few times.
And how were the blood tests each month?
And each month, a blood test was, in the beginning, in the very beginning, it was worse. When I stopped completely methotrexate and steroids, it was a little bit worse. But I continue with these supplements, and each month it was better, better, and better. And right now, first time for 5.5 years, it's practically normal. So it's not very low, but it's in normal range, inflammation level. So now all these markers in normal range.
And you're living this experience of being born again, and that's beautiful. And it's very rare, actually. This is the first time I've actually come in person with somebody that has had a transformation. Well, I mean, we've seen them, but in terms of people that found us through the company and then I've flown out to go and meet them, this is the first time I've done that. And we use Zoom, and that's how we met.
Yeah.
But I was so moved by your story. I felt like the world somehow needed to hear this story, and I felt that if people could hear your experience and hear you speak from the heart, that somehow you could change the world. That's what I felt, and I felt like I had to come here.
I'm very thankful to you, because it's actually, it's your program. It's you started it. And this company, Well of Life, also it's like your company. So this is why it's like it's for me it was big pleasure to meet you. I think this is like 100% that what they help me. These supplements help me 100%, because before I try many other things which help a little bit, but to dramatically change condition, it happens only after that.
And then, so with Well of Life, you use these and you got these results. And so you feel like you're a lot more physically stronger.
Yes, of course. Yes. And plus I was able to exercise now. I'm able to walk, and I increase amount of every day, I increased a little bit, piece by piece, but I gain back my strength. If you have issues, if you have serious issues, especially if you consider that it could be connected with autoimmune system, it just starts everything in guts. Everything starts in guts. Like about 80% of cells, immune cells in guts. So this is why, and plus I just made so many tests. An infectionist made so many tests, and everything was negative. Everything was negative, because there are so many different kind of parasites, and they have only very, very limited amount of tests for this. And even if, for example, they have this test, it's not 100% sure that they will catch this moment. But when you see by your own eyes what you had, and plus when you feel after that immediate relief, you understand that test just didn't show this. That's it.
That's great. So you need to. So your encouragement is for people to start, try it out, and see how they go.
Yeah, and so then it's like there will be questions. So it's like, of course, this is why I like this. Online, there you can ask questions. So, and even Well of Life, sometimes they answer your questions. So you just look for answer.
And were the question and answer sessions helpful for you?
Oh yes, definitely. Plus I could, I had my own questions, so they were answered also. So.
That's great.
Yeah.
And that's where you met me first, right?
Yes, by the way, yeah. I'm very glad that we met.
Well, thank you.
Just want to say that it's like, don't lose hope. So there always exists, solution exists. It's maybe very, very close, maybe far, but if you look, you'll find it.
So ask what is the reason for that symptom and address the reason for that symptom rather than addressing the symptom itself. That's called a true root cause approach. But many people are not taught to do that, and many doctors are not taught to treat people like that. And so again, I find this question a lot in the general public, and I want to encourage you, because you're in Jonathan's group, that you guys are a smart bunch, you're really interested in addressing the root cause, and how you address the root cause really starts with your mindset and with the questions that you ask, okay? Ask better questions to yield better answers. And how do you fix an autoimmune problem? Address leaky gut, address underlying infections, address underlying toxins, address other metabolic priority, like anemia can compromise thyroid function and autoimmunity. Blood sugar imbalance can compromise thyroid function and autoimmunity. If you have digestive issues, that can compromise thyroid function and autoimmunity.
Fantastic, Dr. Khan, I love that. So mindset, wonderful. You need to think about how to restore the balance here,
right,
and allow your body to naturally look after the problems, right?
Now just remember, leaky gut is a dynamic process. So it's not like, oh, I have leaky gut, let me just go through this protocol and you duct taped it and for the rest of your life you won't have leaky gut again. That's just not true, right? Because whatever is, let's just say for example, is gluten. You cut out gluten for X number of months, days, and you feel better. But if you start eating gluten again and GMO foods, like Jonathan mentioned, you will develop leaky gut again. So it's something you need to always work on. It's kind of like exercise, you don't exercise and get in shape and then, okay, I'm just gonna sit on my butt and get fat again. You gotta continuously exercise, like brushing your teeth. You always do, it's a lifestyle. Leaky gut, to heal leaky gut, to keep it, not leaky, it's a lifestyle, not a treatment, not a Band-Aid. Okay, I think a lot of people think like they just need to do something for a month and that's it. It may be something you need to do on maybe not super strict all the time, but you need to constantly be minding it. It's a dynamic process. So how do you heal the gut? Typically, in my practice, we use what's called a 4R protocol. Now, some people will say 5R. So basically, these are acronyms. The 4 Rs, there's different Rs, okay? One is remove, which is remove the pathogens or whatever offending agents or the food even, right? So this is where we need to cut out certain food. Gluten being one. For some people, it might be dairy. For other people, it might be certain type of specific food for them. But typically, we want to cut out the most offending food, like your gluten, your corn, your these things. So remove. Number two is we want to repair the gut. That means we want to put in mucilaginous compound to help heal the gut. Typically, we use things like L-glutamine, deglycerized licorice root extract. We use things like aloe vera extract we talked about earlier. So these things tend to coat the gut to help repair the gut. And then we want to replace. Replace means that we want to replace with enzymes that we might be missing or being deficient in. Again, you can have a deficiency of enzyme production. You may just not make enough. Just like people can be deficient in a vitamin, people can be deficient in a hormone. You could be deficient in stomach acid or enzymes. So we want to replace the enzyme because that'll help us with digestion and breakdown of food, which would take the stress off of your own body to have to digest the food. So give it a break and chance to heal. And also when you break down the food into small constituents, then through the intestine, then you don't have to deal with its undigested protein, undigested food, which can actually cause problem or leak out of the gut, which can cause this inflammation. So we want to remove, repair, replace, and also we want to re-inoculate. Re-inoculate means to put back the good guys, right? We want to take out the bad guys, the bad bacteria, but we got to also put in the good guys. So that's by using probiotics to rebuild that microbiome. So that's the typical process we go through. And you want to kind of address each of those in a really good leaky gut protocol. Now, what I like about what Jonathan has done with his Well of Life protocols is that these programs and products, I have looked through all the ingredients. They're all basically generally safe for almost everyone, right? He's designed a protocol that's safe for even the sensitive people, okay? With the dosages and the combination of product and how it's put together, it's safe.
In this episode, we've looked at the root causes of autoimmune disease and the factors that cause an autoimmune response in your body, and an inspirational testimonial proving that even the worst symptoms can be reversed with the correct protocols. We've learned about the negative effects of leaky gut and the best protocols for preventing and reversing the horrible symptoms of autoimmune disease. We now know the importance of removing the triggers like toxins, parasites, and bad bacteria, and that these can slow the body down and create an immune response which leads to an immune system becoming exhausted. We also learned the importance of replenishing the body with good things like probiotics, great nutrition, supplements, and so on. By changing our lifestyles to include a healthy diet, regular exercise, and healthy sleep patterns, we can protect our gut from trauma and our bodies from inflammation and ultimately autoimmune disease. Let's take a look at some of the important information that we covered during this episode. You can use these bullet points to guide you on your journey to discover a holistic approach to preventing and reversing the triggers of autoimmune disease. In this episode, we discovered that autoimmune disease is the umbrella under which over 100 inflammation-based chronic diseases are categorized. Our bodies may be warning us before anything shows abnormal in tests at the doctor's office. Listen to your body. Autoimmune disease happens at a cellular level before it happens at a glandular level. There are common root causes that start triggering a flare-up or autoimmune response. 1, environmental toxicity, such as heavy metals and molds. 2, dietary factors, gluten, dairy, and especially sugar are the biggest culprits. 3, infections caused by viruses, bacteria, or parasites. 4, underlying hormone issues like too much stress-induced cortisol. An anti-inflammatory diet can work against autoimmune diseases and heal your body. When it comes to gut health, what matters is what you actually absorb rather than what you take in. Healing the gut means removing what shouldn't be there and replacing it with great nutrition and probiotics, detoxing and restoring. Drugs give short-term relief with long-term side effects without fixing the root cause. We are in control of our bodies and we can make a change today.